Hey, welcome to the Go-To Physio Sports Massage series. Well, today is the final lesson in the sports massage free mini class, and that is all about how to mobilize the periscapular muscles. Okay, so this technique we may use, or you may consider using for thoracic outlet, shoulder pain patients, a whole variety of patients. But as always, please respect the 80-20 rule. 20% of our time is spent desensitizing these tissues. 80% of our time and attention is spent on giving a graded exposure, low tolerance to the tissues that aren't doing their job, that's causing these tissues to react like this in the first place. Okay, so please use these techniques responsibly. If you want help finding the true cause, head over to thegotophysio.com. I've got plenty of tips and resources there for you. But with that said, let's get stuck into my favorite techniques to mobilize the periscapular tissues using sports massage techniques. I'll see you on the other side. Okay, so for the scapula and the shoulder, again, just in this position, we can get some nice leverage into using our own body weight. So for the shoulder, you know, usually if I am coming around here, I would use some kind of two-finger techniques. Again, we can use a forearm with the scap, but again, it's quite a thin tissue there that consists of the rotator cuff and the skin, etc. So if we're going through a forearm, the one thing I would be fearful of is just compressing the tissue too much. Okay, so all we're trying to do is lengthen the tissue and give it some kind of stimulus. Okay, so what I would do is sink through the skin, and then I would just go through and work towards that attachment site, and I can get in quite nicely here to the rotator cuff and create about some kind of change here. Okay, if I want to get into the rhomboid on the same side, again, cross my hand over, and again I can get up through here. And again, you want to be careful of coming up through here, because the rhomboid's going to go crossways, so we would almost be putting a lateral force through the rhomboid in that scenario. But if you wanted to, you could also just come across the tissue, sink into the tissue, and then just lengthen that tissue through the origin to insertion. Okay, so from that medial border towards the spinous process. Same with kind of levator scap tissues here. If we want to go through it, we can sink in and we can go through it there. And then in this position also, I can just use my hand to decrease the protective tone if there is any around the trapezius. Okay, sometimes I will just hold that trapezius and I will just let my fingers glide through it. Okay, but as I said, I don't like using my elbow on this area. Okay, I think it's an area where, like, especially the trapezius, is quite a thin tissue. We don't need as much force as we think we do here, especially with levator scap as well. You know, it comes quite lateral to the neck here, and just putting a force through that, you know, just with my thumb there like that. Obviously I'll use oil, you know, or we could double it up if we needed to, but again, it's getting the attachment point and just following that tissue and trying to make some kind of change there. It's more important than, you know, just compressing the tissue for dear life. Okay, because I think the person will just tighten up and they won't necessarily go about restoring, reassuring the ability to tolerate loads through that tissue. Okay, so that'll be your levator scap, your rotator cuff, your rhomboid, or anything else like that. Okay, so as I said, you know, we're just being over the tissue, and again, you can just get some nice work through it. Just sink into the tissue, and then, you know, drive your body through if you want. Okay, so that your hands don't have to do all the work. So your hands are almost the guide, but it's the full body weight that drives the fingers through. Okay, so that's your shoulder and scapula.